We're moving right along, and from Raleigh-Durham, North Carolina, and the Research Triangle Park, and New Delhi, India, we present Startup Masters. And today I have a very special guest, a person who sits on the IBM TV Board of Advisors from New Delhi, India, Ankit Khandelwal. Welcome to the show.
Welcome, Ankit. You forgot to introduce me.
Oh, yes, and of course, I keep forgetting. There's Kim Calhoun. She's also here with us today. I just keep forgetting. So we have two people. I have to look this way to be able to see it that way. So Ankit, tell me, you're in New Delhi right now, right?
Yes, I'm in New Delhi.
Okay, now it's called New Delhi, but there was actually an old Delhi. Tell us a little bit about that.
So it's called Delhi. Then once we have developed a new Delhi for new people to come migrating from different parts of the country.
Mm-hmm.
So that's why we segregated between Old Delhi and New Delhi.
Okay, so there's an old Delhi and a new Delhi.
Yeah, it's part of the same thing. It's just that there's a differentiation within old and new. The New Delhi is all new construction. Old Delhi is an old city, and now we are upgrading it to National Capital Region, which is integrating all other cities from different states and making it at a bigger place for Delhi, because Delhi is the capital, but it's a very small place. But it's the capital of India. Yeah.
Small place. How many people live in this small place? Tell me.
Don't ask me how many people, because if I call small place, that doesn't mean the population is less. It's the population as of now would be around 5 to 7 CR.
Okay.
Which would be around more than 50 million.
Wow.
Oh, okay, so that's a small place. Okay, see, in India,
like the little towns here in North Carolina.
Yeah, around New Delhi.
It's bigger than North Carolina.
It's a small place. Not too many people live here. About 50 million in the area. So, okay, that's India for you, where they have 1.3 billion or 1 billion plus people, and 50 million live in your little town. Okay, now you're in the little town of New Delhi, which has about 50 million people. Small town in India. Be a big town in the United States, but that's another story. And you started Watermarc Technologies. Tell me about Watermarc. How'd you get involved in this?
So I was always into business, and I am from a traditional business background.
Mm-hmm.
All my ancestors are into businesses of textile, of automobiles, of jewelry, of chemicals, of industrial equipment. But I'm from that era where computers started in 90s, and I born in 83.
Mm-hmm.
So I've been seeing the technology growing from big mainframe computers to laptop, and
Really? Wow.
so I keep on learning new things. I From the school time I know that I want to do business. That was clear. And after my basic education in India, I came to US
Right.
for further studies, and I worked sometime in US in New York, Virginia.
Where'd you go in the US? You went to New York?
Yeah, I went to New York. I was in Virginia as well, and I
Okay.
lived there for around 3.5 years.
Really?
And
Wow.
I was on H1 at a point of time, but the bad part is that I was in US when the recession hit. Hit hard to everyone, and I
Right.
was one of the victims.
Yep.
So my experience of US is very terrible, because there are a lot of experiences which I haven't heard or I haven't seen.
Mm-hmm.
So I came back to my country, and then I started Watermarc.
Okay, and then you started Watermarc after you found out the recession here didn't work too good for anybody, actually. And we do go through recession periods here. It goes up and down and up and down. And okay, so what is Watermarc?
I want to ask a question. Sure. So you are an entrepreneur. You are employed by yourself. How does that? What kind of impact is that in your country? You've kind of worked here in the U.S. a little bit. How do you compare the two?
Mm-hmm.
So if someone comes from US after an education, it's like skyrocket. I mean, everyone is looking forward to you.
Mm-hmm.
But I came back when I was 25.
Right.
So I was in US when I was 21.
Okay.
So it was a very young journey for 3.5 years, and then when I came back, I am still very young,
Mm-hmm.
and I was looking for an opportunity which was not appropriate in India, because India and US, I mean, there are two different demographies, two different industrial companies. So there's a gap in between the technology and the growth of the business. And I'm from a traditional background, and everyone in India are, I mean, we can say that they are entrepreneurs because they have a psyche to do some small businesses throughout
Hmm.
their life, because they don't want to be bossy from someone else. So
Hmm.
they can work alone for like 40 years.
Oh, really?
But yeah,
Hmm.
I have known a lot of people, but what I wanted to do is I'm shifting from a manufacturing background to a service background,
Right.
which is very new in India, and I mean very few people take that kick to change their, I mean, mindset from manufacturing companies or manufacturing service companies to totally service providing companies.
Hmm.
So all my family members were questioning me what I'm doing and how I'm doing and what should I do and all those things, because no one is ready to pay for services.
Hmm.
For service India, I mean, in India you can't expect things for services. I mean, if you are showing a feasible product, then you can get money. Otherwise, it's difficult. But
Really?
I know that because I had a good experience in US, understanding the service industry and how people doing it globally, and I am a believer of global audience, and I mean, I think that in next 10 years there should be global citizenship where people will move from one country to another, and just think of a thing basically. So
Hmm.
I am a believer of services, and I started this. I know that the path is very tough, but still moving on, and let's just learn the process and things while I'm doing the work. And I've
Hmm.
learned a lot of things, partnering different companies from Google to Amazon to you name a company, I'm a partner of that company, and I've learned a lot of things and technology throughout my process. I'm still learning and then implementing those services in India. Although I'm not getting that much amount of money in India as in US or any another country, but still it's a process where we have to follow it and just wait for a right time. That's it.
Right. Yeah, and you also have an interest in the health industry. Tell us about the health industry that you have over in India. Over here, it occupies about 20% of our gross domestic product goes into health. It's very expensive. Tell me about how it works over there.
So healthcare is I mean, everyone is related to healthcare, and why I'm interested, because I've seen a lot of people who are not able to get the basic healthcare in
Hmm.
India,
Right.
because we have around more than billion people in our country. We
Hmm.
still have a lot of doctors, but because of the opportunity and because of the Western interest and things like that, a lot of people are migrating to different countries because
Hmm.
they get good amount of money as well. So doctors, apart from technology tech guys, doctors are also a community which is moving abroad for better healthcare and better lifestyle.
Hmm.
And in my family, there are a lot of people. I mean, a lot of my family members, they are suffering from different health issues.
Hmm.
So, I mean, since my young age, I've seen a lot of people struggling with healthcare and all those things. My father is in, he is a diabetic nephros patient. Right now, he's undergoing a dialysis. I mean,
Hmm.
right now, the dialysis is going on. So, he goes for dialysis every week, thrice a week.
Right.
And all other family members, I mean, are also suffering from diabetes, from cancer, from different things.
Hmm.
And I think that technology and healthcare could be a game changer if you talk about I mean the global issues for the next 5 years. And
Hmm.
I understand technology, I understand the business side. So what I'm doing is I am integrating businesses and optimizing them using technology. So that's
Right.
my USP. And
Hmm.
healthcare is also, I've seen a lot of doctors struggling for small operations and management issues. They don't know what to do and all those things. So to save time, we give them small solutions, and that will help us to optimize their thing.
Hmm.
So in India, one doctor sees around 100 odd patients a day.
Wow.
So we are trying to optimize them to so that they can at least diagnose more than 200 patients a day by using
Hmm.
different platforms like Skype and GoToMeeting and things like that. So we
Hmm.
are still improving day by day and working towards the healthcare analytics, which is the next big thing after the basic healthcare diagnosis.
Hmm. Yeah. Is there anything wrong with training more doctors? Or right over here we have what they call physician assistants. Has anybody thought of that? In other words, get more. You have a lot of people, so why not train more of them in healthcare? What's wrong with
So
that?
yeah, so our in India the basic issue is population, and the strength is also population. So our weakness and strength is population,
Hmm.
and then population means you have to manage more people. You need
Right.
more human management techniques, or maybe understanding how you have to tackle different people. And India is a country where we have like 25, 30 different countries, within the India. If I go to South India, I am also a very new person in South India because I don't know what to do. They don't speak my language. They have their own
Really?
language. So either we talk in English or we talk in common language, which is Hindi,
Mm-hmm.
because they have their own languages and they have their own setup. They are living there from past 100,000 odd years.
Mm-hmm.
So it's like a new country within our country, basically. So
Right.
to manage all these things at a central level, it's little difficult. But still, I mean, people who are educated, they know what to do and how to do and how to train things. So things are improving day by day. We
Mm-hmm.
are a 70-year-old country as far as the economics goes because we got independent in 1947.
Right.
So within 70 years, we grown tremendously, but still, I mean, it's a long journey. It'll
Mm-hmm.
take time.
Yes. Right. Yeah. And can you see technology being a way to accelerate the growth and improvement over there?
Certainly, technology is playing an important part of growing India's GDP and all other domains. And
Mm-hmm.
with using technology, central government they are planning to, uh, I mean, offer free healthcare to
Mm-hmm.
half of the population of India
Right. Mm-hmm.
without any
So,
co.
one of the things that a few years back that became very popular, and I don't know what it's doing now or if it gained traction, but in America, basically, if you want to afford health care, you have to have insurance. If you want to afford insurance, you better make a lot of money. The athletes here, because it was very hard to qualify, you have to qualify for insurance too. And the athletes here could not afford the insurance. I'm talking about the professional athletes. The healthcare apparently over in India was very affordable. So somebody started this, connecting the dots, and they played intermediary, and they started a program where athletes signed up under them, and they could have their surgeries and medical care, even full body MRIs and maintenance. For a lot less expensive if they come to India. So you have a lot of doctors and a lot of physicians. You have probably a lot of physician assistants to be able to afford to service our athletes here in the U.S. So I found that very interesting. Are you aware of any programs like this?
So there are programs going on at a private level as well as the government level is concerned. And India, if you look about India in any perspective, India runs in two different ways. One is the government way and one is the public sector way, basically. Because
Right.
public sector, individual capacity, people do a lot of tie-ups on day-to-day basis with different countries, with different governments on different projects. And because population is always a challenge and it's a strength as well, so that's why we have more doctors, but we need 100 times more doctors to take care of all Indians. And when you talk about growing our GDP and procuring services for technology and medical for different countries outside, that is one of the important factors. That medical is so, I mean, cost effective in India. People are, I mean, traveling from different countries for a good medical care in India. And if you talk about medical history, I mean, we in India we are doing the medical treatment from past more than 10,000 years. We
Hmm?
have uh, we have proofs of different medications going around in India, from yoga to Ayurveda to Unani to things like that. So there are a lot of doctors who are not medically educated, or they don't have a degree of from any college, but they are treating lives of thousands of people every day. If I'll give an example, there's a guy there's a senior saint in Hyderabad. What he does is he uses a small fish which is edible, and he puts some kind of an secret formula which is some kind of a flour, and he put that on that fish and put it in your mouth. And people are taking that medicine from past more than, I mean, 200 years, and
So
everyone is
here in
happy.
the
And that
U.S., we
worked.
call that a medicine
Okay.
man. So, or we also
What?
call it homeopath,
Homeopathy.
Homopathy,
Homeopathy.
right? Yeah, they
homeopath
have them. They have
therapy.
some of it here, right?
Those are very popular here, and actually, I think some things really do work, and it's very interesting. So let's talk. Let's get back more to you. Tell us more about Watermarc. What do you need from the viewers? Where are you going? What are you going to do? What's your next steps?
So Watermarc, we started this as a basic web development company where we'll be helping companies and individuals who wanted to start their online businesses. It's been like 10, 12 years since we are, helping our customers in India and abroad. And we started with a learning curvature where, because a lot of people who are using technology, they don't know how to use it. Suppose if I'm doing something for your company, but as a director, you don't know what we are doing. You are just, at the end of the day, you are just counting the notes that how much business we are optimizing and giving you back. So
Nick,
we are
can you
trying to.
click on services just so that we can see what the services are?
So we are doing a lot of web-based, mobile-based services with the different partners and helping people to optimize their businesses in different levels, set different parameters for different for different industries. We are working with government and public sector as well. So that's the way we started Watermarc, and then while doing Watermarc, we have developed a lot of products for healthcare, for education industries, for online media, which is how to generate online traffic and YouTubers and things like that. So that we have all done basically. But now our focus is on basic solutions for different industries where they are lacking. Like I'm helping a lot of doctors on individual capacities, and then I'm working on a lot of government sector projects. So how
That's
can we digitize those companies from, because there are a lot of files and a lot of raw content physically landed somewhere. So we are digitizing all those contents to cloud so that they can utilize it for different purposes.
No, that's something that is much needed in a startup world or any business world. Is everything that you're talking about here. As the viewers can see, this is called watermarksolutions.com. And all the many different beautiful works that they have done so far. You are focusing in the medical industry as well with some of your work. But let's talk a little bit about some of the things that you're wanting to do. You sit on the board of advisors with IBM TV. Are you wanting to escalate the platform that you're doing and work with other startups in your community and potentially do interviews with them? I mean, are you wanting to work with them through some of the platforms that we're doing?
So my idea is to set up a global consulting where we help people to scale their businesses, because when you talk about startups at the end of the day, they need business. And to get the business, they are already doing locally, they're already doing their own business. So they need small tweets and small favors from established companies so that they can go to the next level. And as far as IBM is concerned, we can utilize that platform to have a global consulting setup where people from India can establish their business in Africa, in Australia, in US, just a click of a button. So as a board of advisors, we can help them scale their businesses without looking for VCs every time. I know that VCs are very important because without fund, it's not easy for us to establish business in different countries. But still, there are a lot of businesses that doesn't require that much amount of fund. You just need good hands and good support from those, people from those countries who are already into that business. So that is the idea of global consulting. And as far as the healthcare is concerned, I am very keen to have a healthcare program where we can at least help the existing healthcare system of different countries, or maybe developing and underdeveloped countries, to at least come to a par, so that at least everyone should have a common healthcare diagnosed at a point of time.
Hmm.
So
Yeah.
whatever the best we can do
It's
that.
about getting exposure. You know,
Right.
you can need money, but unless you get the right exposure, you're not even going to find that in this day and time. So your motive and mission statement here, working with platforms like IBM.TV, that's
Yeah.
just the true way to connect the global world together to share our information, right, Nick?
Yeah. And then the thing is, the healthcare platform could be scaled worldwide. Right now, to my knowledge, there isn't any, but certainly it could be done where access, at least to basic healthcare, could be done a lot through the internet on a worldwide platform, so that somebody could meet with a physician. Where here, at least in the United States, yeah, you get a meeting several weeks. You're dead by the time you get a meeting here, even though we have, quote, health insurance and a wonderful system. It's kind of problematic, in other words.
Well, Nick, we've started a health channel, and
Yeah.
Ankit has offered, as busy as he is and all these things he's doing, that is the task that he's picked up is to implement the healthcare channel. And he wants to connect the dots of all the people globally, not just
Right.
India, but what are you doing
Right.
in Africa? What are you doing in the
Sure.
US?
Yeah.
What are you doing in Timbuktu?
Casablanca.
There's so much going on globally, and not just in the science of medicine, but also, like Ankit was sharing, what people do personally, just to utilize natural resources to help their community, maybe help build an immune system using sunflower seed oils, or like you said, fish, just building your immunities, in your local community. This is live TV, so nothing gets edited. You never know what you're going to see on here, me taking the hair out of my face.
Yeah.
But we want to connect the world here at IBM TV. We want to help Ankit get that connectivity going. So if you've got an idea, if you're doing something in the healthcare industry and you want to share it with the world, then contact Ankit. He's also the subject matter expert with Watermarc, and getting your statement out there in the most beautiful way. Look at what they do here. And so just, reach out to Ankit if you want to be part of the Healthcare Channel Network
Healthcare channel.
and getting your business going.
Right. Yeah. And Ankit, I noticed you work with the Indian neurosurgery, best neurosurgeons in India. Tell us about that.
That's impressive.
That's impressive.
So what I'm as Kimball said that we have to make sure all the dots are working on the same direction. So what I'm doing is I'm giving free consulting to the associations of different departments like Indian Neurosurgery or Diabetic Associations of India or Nephro Associations of India, just to start conversing and let them understand that technology is not that scary. And if you talk more about it, then as a technology guy, I can help you establish more links and establish more work for patients who really need them. So this is one of the things where we are doing in sessions every quarterly with different associations of healthcare, and then just let them understand how technology help those doctors and patients to have a better life.
Right.
Because doctors are also struggling. If I'll give an example, doctors start their day at around 7:30, 8 o'clock in India,
Yeah.
and they end the day at around 11:30, 12, or maybe 1 at midnight.
Yeah. They work very hard.
And they don't take, and they don't know where the sun, from which direction the sun is rising and from which direction it's sunset. They take a
Right.
lot of vitamin B's and all those medicines sitting inside their premises.
Yeah,
Right.
it's weird that you say that because, about the long hours they work, especially the surgeons. One of my brother-in-laws was in a really bad accident and lost the use of his right arm due to severed tendons and nerves. And they performed a surgery, and so they only do this surgery, 1 or 2 days a month. And I was like, wow. So when I went to meet the surgeons with him, they tell me, that they literally work from 5 o'clock in the morning doing surgeries, because his surgery was 8 hours. So then they take on another 8-hour surgery. So they're in the surgical room for 16 hours. Then they have to support that surgery. And they are not making a lot of money. Even with our insurance system, they don't generate a lot of money. But these healthcare people, the real healthcare people, not insurance, I'm not talking about insurance, real healthcare people, the physicians, the nurses, the technicians of healthcare, the subject matter experts for anesthesia, all of them, they, right down to the admin who checks you in, they are the ones who are taking care of you, and they are working long hours, and we need to figure out a way to make their jobs easier. And it looks like that's what you're doing, and getting money in for these resources and the technical solutions, artificial intelligence. There's got to be a way that we can utilize artificial intelligence more effectively to make the quality of life in healthcare.
I believe machine learning and artificial intelligence can be a game changer in healthcare industry, because if we have a pre-medical diagnosis or pre-medical advices from any doctor or any technician who understands the healthcare, we can prevent and we can help that patient to survive or to deal with those problems and disease at a point of time. Because once you cross that line, it's very difficult. And
Right.
if you're suffering from chronic disease like a kidney problem or a cancer issues, so people are struggling. They are. I can't even express. They are living their life on a machine basically. My
Mhm.
father, my father visits the hospital every second alternative day for 6 hours on a dialysis machine just to clear their blood.
Right. Right.
So it's a painful thing, and they can't work as well because the immunity is very less.
Hmm.
So
Yeah.
so
No, it's a much needed and what your channel is going to be doing is exposing all of the great and wonderful uses of technology, what's coming in the future. We're going to be able to hopefully predict some of the stuff that's going to be coming in the future, and that's going to be on our channel
Yes.
on IBM.TV, right, Nick?
Right. Right. Yeah. Because there's no healthcare channel that I am aware
And
of
Ankit's going to run that
in
channel.
the United States. So if you want to deal with a healthcare issue here, you're kind of like lost. In other words, it's good luck to you.
It's
But
oversaturated right now. There's nobody
yeah.
filtering out all the noise and what's
Right.
real. And
Right.
that's what we're going to do.
Yes. Right. And we're going to do it on a
You've
worldwide
got a
basis.
great idea for
Yeah.
medical care or medical whatever, and
Right.
technology especially, bring it to us.
Yes.
that
Let
Right.
Ankit
the
help us.
problem the problem with the healthcare companies or people who are working for healthcare companies, they don't talk to each other, first
That's
of all.
correct. Right.
And
And that's
secondly,
what we're going to be about. We're going to
everyone
be
is,
about sitting around, having a little bit of coffee,
yeah.
They
enjoying
work
the
all the
conversation.
time. They work all the time, and they don't talk to
But
people,
secondly,
each other.
yeah, secondly, everyone is working for health insurance companies, and
Right.
those companies they don't care. And the
They're just
important part is that if you are not talking to doctors in between, and I
right.
am seeing three different doctors from three different
Yeah.
hospitals, it's difficult for me to survive
Yeah.
because everyone has their opinions. So my
Correct. And
agenda is
right.
to bridge them and then fill that gap with technology and with AI, with machine learning, so that
Right.
at least they start talking and then helping patients to feel better, basically.
Yes. Right. And the thing is, and then we'll be able to bring up healthcare issues around the world on IBM TV, which there
Yeah.
is no place that does that right now. So we're running out of time. So what we'd like to do is thank Ankit Khandelwal and, of course, my co-host Kim Calhoun, who I forget even though we're on all the time.
He still loves me. That's the people who love you the most are the ones that forget you.
Duh, forget. Okay, well maybe it's an age thing, which we'll have to discuss on a future IBM TV Health Channel
Hey,
network.
maybe
But
Alexa can help you remember, Nick.
well, I always think, well, if you can't do neurosurgeon, that's not going too well because you have glioblastoma. Go up here and get a drink, and that'll solve everything, right? So Ankit already has a solution. We just have to go find it. But we do thank our viewers for watching IBM TV and watch for our future shows on the healthcare channel. So thank you all for attending, and we'll see you next time.
See you next
Coming
week.
soon. Take care. Bye bye.